Western sort of shamanic team, really, isn't
Yeah.
it? Because it's very much shamanic practice what you're doing. It's
Yeah.
very much what a shamanic practitioner would do.
Yeah.
These are universal principles. They're just given different names by different people.
Yeah.
I tend not to use labels.
No, you use it all.
I just describe what we do in the language that I have. Yes.
I'd like to hear more about what you actually do as a psychologist and hypnotherapist. So you talked about telepathic hypnosis.
Mhm.
But what's your process?
Okay. If I was working with a client face to face in a therapeutic situation and I was going to use hypnosis, I would invite them to go into a trance, and then I would deliver suggestions to them that hopefully would be beneficial. Okay? When I'm working with a person who is many miles distant, obviously I can't do that, but the principles are exactly the same. The medium connects with the client, the patient. And I will say to the medium, right, I want to have a conversation with this person. Can you draw their attention to your presence? It's like walking up behind someone and gently tapping them on the shoulder and saying, we're here. And so the subliminal mind, or the spirit, call it what you like, of that person turns around and says, oh, where did you come from? So when the medium has the attention of that person, I say, I'd like to ask them if I can have a conversation with them. I'm here to help. Do they need any help? So then I begin a dialogue with them as if they were a patient sitting in front of me face to face.
So it's the medium who's communicating this information back.
The medium is conveying to me what the patient is experiencing. So I'll say to the medium, become the patient.
And how far are you away from the medium?
He's in Wiltshire and I'm in Kent. This is on Skype.
So you see each other on Skype?
We see each other on Skype.
Okay.
But the only ones that are visual are the ones that I want to record visually. If I think it's going to be a particularly interesting case for study, then I'll record it visually. But I don't have to.
But you're always with Andrew. You said it's Andrew.
Yeah, I work with other mediums as well.
But when you do that work, you have Skype or real contact with Andrew?
Skype. I have done real contact with him, but he's just too far away from me. And why travel when you don't have to? It's expensive travelling, isn't it? So the patient is sitting in front of me in my mind's eye, and I'm hearing what the patient is saying, but in Andrew's voice. And then I will take them through what I have found through trial and error and practice, a series of mental exercises that I find very, very valuable in helping a person to recover. And the most productive method that I use, it's quite funny actually, when it works, and it usually does work, is to ask them to imagine that they're looking in a mirror and tell me what they see. And they will describe themselves looking in a mirror. And very often, probably the most common depiction that a person will see of themselves is a cowering child in the fetal position, trying to hide and become invisible because they're scared, because of something that's happened in childhood. This is a 23-year-old man who's got this inner child that's terrified. And so using telepathic suggestion, I say, look in the mirror and tell me what you see. And that's what they see. And I say, do you want to stay like that? And yeah, it's safe. I'm too scared to come out here. So then you have to go through the therapeutic process of trying to persuade them to grow up and attention. And this is where the skill of the hypnotherapist comes into its own. Of course, you can't do that if you've got a patient who's on antipsychotic drugs in a psychiatric hospital in Michigan. But using this method you can.
It's predicated on you having a good mediumistic support, isn't it?
There are two essentials for this. The first essential is having someone who is a good medium, who is able to convey what they are getting from the client, from the patient, right? Without imposing their own ideas. Right? They are purely a non-thinking medium. Okay, that's the essential requirement to start with. The second essential requirement, from the therapist, from my point of view, is a very, very good knowledge and experience of the therapeutic process using hypnosis. So you need someone who's trained in hypnotic technique to be able to deal with a patient using hypnosis. So it's a bit different to what most people would perhaps believe I do, because a lot of my work in recent years has been with spirit release. Spirit release is the first part. Get rid of the spirits first. Going back to your earlier question, there are different levels, energetic frequencies, where different forms exist and interact with us. I haven't mentioned yet the earthbound spirit. That's the spirit of a person who's died and hasn't moved on, and they're still earthbound. The ghost, if you like. I was at a conference 2 weeks ago in Aberdeen of sociologists who were interested in the supernatural, in ghost hunting and all that. I said, let's stop talking about ghosts. These are people who've died. It's a spirit that's earthbound, and they need to be treated with respect and helped move on. So once we've dealt with the dark force entities, the destructive ones, the exploitative ones, get those out of the way, then we deal with the earthbounds that are attached for a variety of different reasons. We've checked the grounding of the spirit within the body. Then we check, there's another frequency wave band that needs to be looked at, and that is where the interdimensional parasites come in. And these are like spiritual bugs. If you step out into the world and you cut yourself, you can be infected with bacteria. You have an immune system to protect yourself from that. This is the physical body has an immune system. Okay? The etheric body also has an immune system, and if it's penetrated, if it's compromised in some way, then you've got spirit bugs that can infect you and drain, sap and drain your energy. So those are cleared away. So we go through these different energetic frequency ranges. It's like going from infrared to ultraviolet. You've got to check every level to see what's there, because the vulnerable person will be affected at every level.
It's also important for the hypnotherapist or yourself to have a belief structure which can incorporate all of this wider picture.
I would exchange the word belief structure with knowledge structure.
No.
There's a difference between what you believe and what you know, isn't there? You can believe anything. And what I'm conveying to you is what I've learned from experience, so it's not my belief. I'm speaking now as a psychologist, as a scientist. These are the facts I've learned. And I apply that knowledge to the work that I do. And again, we have to ask the question, going back to William James's pragmatism, does it work? Is it real? Yes or no?
Just a quick question. You have to be quick. You said that you don't have any actual contact with the client,
Right.
but are they aware that you're going to be intervening for them? Do their families tell them that you're going to be intervening for them?
No, because these patients are usually beyond the capacity to communicate.
But they can still, understand if someone's communicating.
No, not until after not until after the work has been done. To give a clearer answer to your question, the most recent case, a 71-year-old woman in Germany. It was on the third intervention session that I felt it was time for her to be aware of her presence. So I said to the medium, Andrew, would like to speak right now. The family had no prior warning of this, and they couldn't tell her. So she was completely unprepared, and I just spoke to her and had a conversation with her and said, just like to let you know that we're here to help you. At the request of your family, your daughters asked us to help. So we're here to help you recover. Is that okay? And she said, yes, it's okay. And her being German, being a mother, I trusted as duty, which she accepted. So the trust was established straight away. And she was happy to talk to me. I said, are you going to be okay now? And then the next day she baked a cake for her daughter.
I think we can all agree that, that this is a fascinating subject. We could talk about this for hours, and I'm really sorry that we've come to the end of our time.
Well, thank you for giving me the opportunity to talk.
Yeah, no,